Hello and welcome to this live interaction with me, Ashish Parekh, and today we'll be talking about the COVID-19 cases in India. Meanwhile, India, as we all know, has recorded almost 6 million COVID-19 cases so far and over 94,000 deaths so far. And the number of cases are being recorded every day, much more than any other nation in the world. However, there is a silver lining. Yes. For the first time since the beginning of the outbreak, the 7-day average of daily COVID-19 cases in India has been steadily falling for 9 consecutive days from September 17 to September 26. In fact, the icing on the cake is the fact that despite the 7-day average of tests having increased from 10.7 lakh on September 17 to 11.2 lakh on September 25, this decline is being recorded across the world, and the data is available with the European Center for Disease Prevention and Control. And this data also gives us a very interesting perspective. It also says that the 7-day average of daily COVID-19 cases in India had reached 93,199 on September 17, which is the highest since the outbreak of the disease. And since then, it has fallen to 85,131, clearly showing that there is a steady decline as far as the 7-day daily average is concerned. In fact, there have been previous instances of the fall in the 7-day daily average of, the daily average of cases. But having said that, those falls were never more than 2 consecutive days. But this time, a complete, there has been a fall for 9 consecutive days, which possibly is also hinting at the fact that there might be a possibility that India is past its peak. Before we talk about it, let's just also talk about the states that are contributing to this dip. Now, which are the states that are seeing a dip in COVID-19 cases? Well, the 7-day average of cases has started to fall in states like Maharashtra, Andhra Pradesh, Tamil Nadu and Uttar Pradesh, some of the states that have recorded the most cases in India. And also the states that also are seeing an increase in the cases are Kerala, Gujarat, Rajasthan, Madhya Pradesh, West Bengal and Odisha. These states are witnessing a steady increase in daily cases. Also states like Assam, Telangana and Delhi also have shown that there can be multiple peaks. So, that is on one hand we are looking at there being a decline. On the other hand, we have seen several instances of there being multiple peaks. So, is this something that is a good sign? Is this actually a silver lining, or this is just another this is just another fall in the number of cases because after something that is looking after an impending rise? To speak more on this, I have with me immunologist from Mumbai, Dr. Sitesh Roy, who will be shedding more light as to how exactly should we view this data. First of all, Dr. Roy, this is something that is that is encouraging given the fact that there has been a fall in the number of cases for the past many days now. But having said that, there have been several instances wherein there has been a fall like this, but then suddenly there is a steady increase in cases and there are multiple peaks in a country. So what exactly do you think is the situation in India? Is India past its COVID-19 peak?
So Ashish, the most important thing to remember in the midst of any epidemic or pandemic is that we should never be quick to celebrate and we should never be quick to panic.
Yeah.
These two words should never be associated with the pandemic, because a pandemic is a very unpredictable situation. We should be happy, we should be glad, we should be positive and hopeful that there is a decline in cases, that our case fatality rates are not rising. But at the same time, if we have to learn not just from what has happened in Spain or US, where the cases dipped and then rose again to very significant levels, almost doubling from the first dip. Recognizing that even in the Spanish flu of 1919, there was a lull phase where the cases around the world, that was an influenza outbreak. There were so few cases that everyone had thought that the pandemic was over. They let down and it came back with a vengeance and killed twice as more people in the second wave than it did in the first.
Okay.
So recognizing that we are doing a better job in testing, better job in contact tracing, better job in treating, the drop is a good sign. But I strongly want to say that we should not let our guards down, because sometimes these temporary lulls come, then the cases spread like wildfire again. So we should, as they say, hold our horses before we jump to any conclusions.
Yeah, very interesting point you're making there, Dr. Roy, because you've been talking, you're drawing parallels to other pandemics that have happened across the world in the past, wherein there has been a very steady rise and there have been multiple peaks, and so clearly it shouldn't be a case wherein we are celebrating too early. In fact, let's come back to this pandemic itself. Even here we are seeing examples of there being rise after subsequent decline in the 7-day average. For example, countries where cases have risen steadily after a long stretch of continuous fall. For example, let's talk about US. US reached its first peak on April 11 when the 7-day average of cases reached around 31,942 cases. It then fell more or less steadily to reach 20,638 on May 29, and everyone thought, okay, the pandemic is over. Then the cases started rising again to reach another peak on July 20 when the 7-day average was around 66,903, which was much higher than the previous peak, and again it fell to 34,320 by September 13. And again there has been another surge which has taken the average to 44,109 as of September 26. Even countries like Russia, Spain, France and the UK, like you mentioned, are also seeing an increase after subsequent decline in the number of cases. So clearly there is a possibility of another peak. So what can the government do? What can the health system do to make sure that there is no subsequent increase in the cases? But because there have been multiple peaks across the world, what have they done wrong and what can we do right to make sure there is no other peak?
So if you look at a careful analysis, I shall speak only about the United States right now and what happened there. One of the reasons why there was a second wave that was seen, or a second rise, where a different group of states were affected. So in the first group, it was New York, New Jersey, California, some of these states were affected. And in the second rise, where there was a massive rise, it was states like Florida, Texas, Arizona that were very severely affected. What started happening in some of these areas is, one, the unlock was done too fast. Second, colleges were reopened, and when colleges were reopened, a lot of youth who felt that they were immune to this disease, that this disease would not affect them or make them sick, came together and started partying and started, bars, clubs, pubs, restaurants opened. People started having a good time, and before you knew it, they were hitting another peak again. And so these kind of mistakes are very important for other governments around the world, including the Indian government, to recognize and be slow and gradual in reopening, and also be careful not to reopen schools and colleges yet, because I do not think the Indian healthcare system is ready to handle an onslaught if we have a lot of young people starting to get sick suddenly. So I think the lessons are all there for us to learn, Ashish. It is not a rocket science. Go slow, take it easy, and keep a relentless drive. I would say a relentless drive to educate the public that the pandemic has not slowed down and it has not stopped. The coronavirus is very much here. COVID-19, SARS-CoV-2 has not left our midst. And we have to remember, it's not the virus that spreads, it's the people that spread the virus.
Yeah, true. Also, Dr. Roy, another interesting analysis that you've done there, you said that in the United States there were multiple peaks, but if you look at it in detail, the peaks were in different portions. For example, in the first set, a particular set of states were affected, and then in the next peak there were another multiple sets of states affected. So, it is not like, the entire nation sees a peak at one point in time. You have particular sets of states that are being affected. And interestingly, if I just look at the number of the states that are being affected as of now, the pattern is pretty similar in India as well. For example, the most affected states right now, like Maharashtra, Andhra Pradesh, Tamil Nadu, Karnataka, Uttar Pradesh, these states are seeing a steady decline in the number of COVID-19 cases, whereas states like Kerala, Gujarat, Rajasthan, Madhya Pradesh and West Bengal are slowly seeing a surge in the number of COVID-19 cases. So, the pattern is eerily very similar.
Very true, and I think this has to do with movement of people. As I said, as people travel for work, for business, for relocation, some have gone back to their home states because they were not working. There are financial issues. I know everyone is going through them in the whole wide world and also in India. So I think it's the movement of people that then creates, and that's why it becomes so important for people to follow the quarantine rules. So if they are moving from one place to the other, and they realize that they are coming from a high risk, what they call a hot spot, to maybe their home state, they need to really self-quarantine themselves for 10 to 14 days, make sure they are asymptomatic, not interact with a lot of family and friends just because they got home after a long time, because you're just putting yourself and your family and friends at risk. So I think everyone needs to have patience. It's patience, very, very good wearing of masks. Even if you're around one or two other people, wear your mask and wear it correctly. Masks save lives. Masks save you from another person's infection, and masks also save another person from you if you carry an asymptomatic infection or a symptomatic infection. Stay at home unless it's necessary. Hand wash, hand sanitize, maintain physical distancing, and I think we can really get this pandemic under control. It's in our hands. It's not in anyone else's hands, Ashish.
Thank you, Dr. Roy, for your insights there on this topic. So clearly, Dr. Roy is saying that, yes, this is a positive development. The number of tests we are carrying out, the contact tracing, everything is on the rise. At the same time, the number of cases are declining. This is a good sign, but it is too early to let our guards down. But having said that, well, there is some positive side to this as well. For example, countries like Brazil and South Africa, which reached their peak values of daily cases in around end July, haven't seen those level rising ever since then. Countries like Colombia and Mexico also reached their peaks in August, and there has been no second wave ever since. But having said that, we also have to look at countries like the United States, where there have been multiple peaks, and again in different sets of states, and that is something that is happening in India as well. Some set of states which had recorded highest number of cases are now seeing a steady decline, wherein some other states where there were not many cases are now slowly seeing an increase in the cases. All in all, this is something that is a positive sign, and is something that we need to build on by making sure that we take the necessary precautions and also do not put our lives on the risk and also lives of other people. So do let us know what you guys think of this development. Is India finally past its peak? Do let us know what you think in the comment section below, and also do not forget to like, share and subscribe to News9 Digital. Thanks for watching.